Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about miscarriages and their relationship with PCOS or polycystic ovarian syndrome. Miscarriage can be defined as miscarriage is also called as spontaneous abortion or early pregnancy abortion or early abortion as well. Okay. From the day you have conceived before 20th week, if you are taking it into a week schedule, if anything happens before the 20th week, so what should happen before the 20th week to we call it as miscarriage is that if you're taking it as a week slot, and then if the embryo or the fetus is dead and it is expelled from the uterus, then that is called as miscarriage, or it can also be called as spontaneous abortion if the embryo is dead inside the uterus and is expelled from the uterus. So this can be called as miscarriage if it occurs before 20th week of gestation. So what are the signs and symptoms of miscarriage? If you're someone who has been experiencing this miscarriages, you should know about the early signs and symptoms and also what should be done in order to prevent these miscarriages. First and foremost one is vaginal bleeding. If you're seeing any sort of spotting, it can be even a drop of blood, do consult your gynecologist as soon as possible, because in some conditions, like in some people, there can be very mild spotting or very mild menstrual blood, but the embryo or the fetus is expelled and you do not even know that it has been expelled. You have to get your USG done to confirm it. So if you're someone who's pregnant and if you're feeling any sort of spotting, please do consult the gynecologist as soon as possible. So in events of miscarriage, the primary thing every person or majority of the people will notice is vaginal bleeding. It can range from spotting to heavy menstruation. It depends upon the age of gestation or the age of the embryo or the fetus. And then cramping in the lower abdomen, especially pain which is cramping in nature, which is twisting in nature, where you feel like there is some sort of weight in the lower abdomen and it's been pulling down. That kind of pain you will be experiencing. It can vary, it can be very mild or it can be very severe also. And then disappearance of pregnancy symptoms. What are pregnancy symptoms? And if the pregnancy is divided into 3 trimesters, each trimester will have 3 months. Okay, 1, 2, 3 in the first trimester, 4, 5, 6 in the second trimester, and 7, 8, 9 in the third trimester. Okay, in the first trimester, especially pregnant ladies will be experiencing, majority people will be experiencing nausea, vomiting, fatigue. Okay, if there is disappearance of nausea and vomiting without taking any sort of medication, and after spotting, you have to suspect miscarriage. It can be miscarriage. I'm not telling all the cases will be, but mostly if you are experiencing spotting or menstrual bleeding along with the disappearance of nausea and vomiting, if you should be having the symptoms for them to disappear, right? And then you should not be taking any sort of medication for them to have disappeared. Okay, so this is the condition: disappearance of symptoms and also disappearance of breast tenderness. Some people do experience breast tenderness. If you have it and then it suddenly disappears after spotting, then you have to suspect something is not right. And then backache is one of the concomitants, or it can be called as, it is one of the complaints which is accompanying this miscarriage. If you're having pain in the lower abdomen accompanied with back pain and spotting or bleeding, do get a doctor consultation as soon as possible. And then there is dizziness and fainting. This can be symptoms associated with miscarriage: dizziness and fainting. You have to remember these things. And then missed miscarriage. In some cases, pregnant lady might not even notice these symptoms. This is very, very usually it is not as frequent, because people who experience miscarriage usually know it. Very rare number or very less number of people do not understand or do not know if they have had a miscarriage or not. So they might not be experiencing any sort of pain where they feel that there is a need to consult doctor. So the pain can be there which is very mild, bleeding can be there which is very mild or very less amount of bleeding, and then the disappearance of they might not be experiencing even nausea and vomiting in the primary phase or in the primary trimester also. So in these kind of cases, they do not even know that there is a miscarriage, and only a USG scan can diagnose what has happened to them. So these are some of the signs and symptoms of miscarriage. Now let us see what is the connection between PCOS and this miscarriages. Is it relevant that PCOS patients experience miscarriage? Yes. if we take 100 people who are experiencing miscarriage, out of that the causes for this miscarriage 30% to 50%, it can vary, but usually 30% to 50% can be because of PCOS, or the risk factor can increase because of PCOS. Okay, for example, there is 100% of risk factor for miscarriage. 30 to 50% there can be increase in this risk factor because of PCOS. PCOS can cause, or can trigger miscarriages, that can be said. Then coming to the pathological part, or what happens, or what is triggering this miscarriages in pregnant women. So as you can see, here is a picture of the uterus. Okay, now I'll be explaining it to you in a detailed manner how each factor of PCOS can cause miscarriage. The first and foremost thing is hormonal imbalance. As you know, in PCOS we have to follow the Rotterdam criteria, which is the pi category. What is pi category? That is PIE, the pi category. Okay, always remember the pi category for PCOS. P for polycystic ovaries in USG or ultrasonography, and then I for irregular periods, and E for excess androgen. So because there is excess androgen in polycystic ovaries, or there is excess androgen in PCOS patients, what happens is that whenever there is excess androgen or excess testosterone in the body, there is another layer inside the uterus called as the endometrial layer. Fine. This endometrial layer usually thickens so that the uterus will be able to hold or implant the baby. The baby travels from the fallopian tube and gets attached to the uterus lining inside the uterus. Okay, inside the body of the uterus. After it gets attached and the baby starts growing inside. Okay, so what happens is that if the endometrial thickness is not as much as it's supposed to be, if it is thin, then what happens, as the baby starts growing, the weight starts, there is gravitational pull always, and the weight starts increasing and the endometrium is ripped off. Okay, so endometrial thickness, if it is not as much as it's supposed to be, then there can be miscarriage. Why is there not enough endometrial thickness? It is because of excess testosterone or excess androgen in the body. And then we have insulin resistance, which is also a cofactor in PCOS, because PCOS means polycystic ovarian syndrome. Okay, so syndrome, it has a lot of effect on even other organs in the body. So what happens whenever you have insulin resistance, which is hyperinsulinemia, what happens? This hyperinsulinemia or this insulin resistance can trigger and cause to have a drop in the progesterone. So what is progesterone function? The progesterone function is to increase the endometrial thickness so as to take up the implanted baby and support it. Whenever there is low progesterone level because of a trigger due to hyperinsulinemia or this insulin resistance, what happens? There is a decrease in progesterone level, there is decrease in endometrial thickness, and then miscarriage happens. And then compromised endometrial environment. Because of the hormonal fluctuations, it can be because of increased E1 in the body, decreased progesterone, increased LH or decreased FSH, hyperprolactinemia. The endometrial layer is very, very sensitive to estrogen and progesterone levels. Whenever they are not in a proper manner, the thick and thinness of the endometrium will vary in different, it can vary, and it can cause miscarriages. And then apart from that, oocyte or the embryo quality, whenever the egg is released, as much as the sperm quality is important, so is the egg quality also. Okay, the egg quality should be in a proper, it should be qualitatively good. Okay, so whenever there is PCOS, there is hormonal imbalance which can cause improper or poor quality of the egg to be released. Whenever there is poor quality of the egg being released, the embryo cannot form properly, and that can also lead into miscarriages. And then we have potential for poor fetal development. What is potential for poor fetal development? See, the growing baby needs certain level of hormones in the body. Whenever there is no proper hormones, whenever there is insulin resistance, there can be chance for diabetes, there can be chance for thyroid, and all of these factors can cause poor development, leading to miscarriage or expulsion of the fetus. So you know how PCOS is affecting or triggering or can be called as, the maintaining factor for an improper baby formation. So if you're someone who's suffering from PCOS, do not take it lightly. Please take a doctor consultation as soon as possible. And if you're planning for pregnancy, make sure you're making some lifestyle changes and you will be delivering a happy and a healthy baby. Now coming to how to manage or how to avoid these miscarriages, even though if you're suffering from PCOS. First and foremost thing is understanding that you have PCOS. If you're someone who has irregular menstruation, I will be telling you how to diagnose it yourself. Just understand the pie category. If you are experiencing polycystic ovaries in your USG scan, and or if you are experiencing irregular periods, and if you are experiencing hirsutism, which is male pattern type hair on the face, on the chest and all, and then you're experiencing darkness in the neck area, or darkness in the intimate areas, darkness in the folds of your body, and you're starting to gain a lot of weight recently, your skin started breaking out recently, your hair started falling off more than it usually is, and your skin has started becoming oily, then do consult a doctor as soon as possible. You might be suffering from PCOS or even PCOD as for that matter. If it is PCOD, there's nothing much to worry, but if it is PCOS, then you have to take a doctor consultation, use medication, so that you will not have any sort of problem during your gestational period. Fine. And then after addressing the PCOS, taking medication, and then along with taking medication, see, these three are not something that you should be doing without medication. These are something that you should be doing along with the medication. Though the medication works, you have to support it so that you can attain cure in a faster manner. So what you should be doing is managing stress. There are a lot of PCOS cases in our clinic, and the pattern which we have observed is that people who are having either emotional or marital conflicts or problems, there is stress in that form, and also people who are having a combination of stress which is emotional as well as improper sleep pattern are more likely to suffer from PCOS. The cases which we are seeing in our clinic also, most of them have marital problems along with a sleep problem, that is along with improper sleep schedule. So if there is a combination of two, you might land into one of the lifestyle disorder diseases. Okay, please make your sleep cycle regular. Sleep before 10 o'clock and get up at least 7 or 7:30, before 7 or 7:30. Make sure you get good quality of sleep. Do not take or view your mobile just before sleeping. 10 to 1 is a hormonal repair time, so try to sleep in before that period. And if you're someone who's doing a software job, an IT, if you're an IT employee who's doing a night shift, and if you're trying to get married or going to get married or going to get pregnant, make sure that you shift your work timings, because that might affect, not saying it with 100%, but majority people do suffer from hormonal disturbances because there is no proper sleep. Okay, even if you're sleeping in the morning, it doesn't count, or it doesn't give as much as rest. Sleeping at night will give you a lot of rest compared to sleeping in the morning. So try to shift your work. And then maintaining good blood glucose levels. Try to consume 6 meals rather than 3 larger meals, and try to maintain your blood glucose levels by not consuming any sort of confectionaries or any sort of high sugar content foods, and do not overload yourself with, it can be simple carbs. Try to eat in a healthier manner. Pick your meals, categorize them into proteins, fats and complex carbohydrates, and try eating your proteins and fats first and then come to your complex carbohydrates. By eating in this manner, you will be able to stay full for a longer period of time. Your cravings will come short, and also you will be able to maintain your blood glucose level. Then coming to support and early intervention, if you're someone who's suffering from any of these, try to take doctor consultation as soon as possible. And also, if you're someone who has a tendency for these miscarriages, or if you're someone who's suffering with PCOS or PCOD and you've got pregnant, do take doctor consultation on a regular basis. Do not skip any sort of doctor consultations as suggested by your gynecologist. So these are some of the management features that you need to do even though you're taking medication. Now coming into the conventional form of treatment or allopathic form of treatment. Here we're going to discuss about PCOS and its cofactors like hyperlipidemia, high BP, or you can also call it as hypertension. And then we are going to also discuss about blood sugar level, which is type 2 diabetes. But we're not going to discuss specially about the management or the medicines that they will be giving for miscarriage, because here we are talking about PCOS. So if PCOS can be managed in a proper manner, then miscarriages can be prevented. So we are talking about PCOS as a package here. So PCOS primarily can trigger blood pressure or can cause blood pressure. They will be giving you ACE inhibitors and beta blockers for that. For hyperlipidemia, they can be giving you statins, as well as for your blood sugar to be controlled, they'll be giving you metformin. So what is the problem in taking all of these medications is that they come with a side baggage or side effects. What are the side effects of metformin? It can trigger muscle loss, okay? And then about statins and beta blockers, as soon as you start using them, and if you're not taking any sort of management control over your diet, as well as your anger, or as well as your hormonal issue, these will always be the tag sisters of PCOS, right? If PCOS is improperly managed, no matter how much you manage these things, nothing is going down, or you have to use these medications for lifelong. So how do you manage PCOS? PCOS can be managed through hormonal contraceptives. It can be managed through metformin, which is type 2 diabetes, anti-androgen medications, and ovulation inducers. The problem with hormonal contraceptives is that if you are trying to get pregnant, or if you want to get pregnant, this might not be a great option because it comes with side effects. Even though if you're not trying to get pregnant or conceive, it has its own side effects, which is weight gain, a lot of weight gain, and then acne prone skin, hair fall can happen, and along with that many people have other side effects, like if they stop taking pills in between 2 or 3 days, they can experience intermenstrual bleeding as well, okay? And then it does not cure the condition, it will just help you to manage at a surface level. And then we have this metformin, which we have already talked about, and then we have anti-androgens and ovulation inducers. The problem with this anti-androgens and ovulation inducers is that as soon as you stop taking these medications, this excess androgen will again bounce back, and this anovulation cycles will again bounce back. You might experience irregular periods again. There is no cure as such in conventional form of treatment. It is just managing the symptoms at a certain level, and if you're not regular with your medication, the condition can worsen as well. There is no promised cure in allopathic form of treatment for PCOS, but there is an other kind of treatment which will help you manage your menstrual cycle, which will control your hormonal imbalances, which can treat the tendency to abortion, as well as have lower recurrences if you stop the medication, or if you complete the full course of it, and then there is the lowest rate of recurrence compared to other systems of medicines, which is nothing but homeopathic form of medication. So in homeopathic form of medication, there is no side effects of homeopathic form of medication. It's completely safe to use. It's effective in nature. It will give you better health. How will it give you a better health? Here we will be understanding, of the homeopathic doctor will evaluate your case at a deeper level and understand the link. So what is the link here? The link is that there is a link between your sleep cycle, between your pattern of your thoughts, between the way you express yourself, between in the way you behave, in the way you collaborate with others. So there is a pattern. Each one of us is very individualistic in nature. So if we study that pattern and link it to your physical symptoms, we will be able to obtain a drug which is tailor-made for you, and it will fit all of your problems. And the problems like menstrual irregularities, your hormonal imbalances, your problem with the fertility, the tendency to have miscarriage on the second or the third month, and also the mood swings that you're experiencing and the stress that you're experiencing, and it will help in your weight loss as well as to induce sleep also. So it will manage all the symptoms and give you better life. That is much important, right? And apart from all of this, it will help in relieving the present condition, curing your case, and it will prevent further recurrences in a safe, effective manner, so that you will experience good health in a timely fashion. Your symptoms will start to disappear, and you will experience full length of health. That is very important if you are someone who's experiencing lifestyle disorders. If you are someone who's experiencing female reproductive organ diseases, we have told you how homeopathy has a better shot at curing these diseases. In homeopathy, Fidicus homeopathy gives you a much better shot at health. Here we have two kinds of consultation options. One is offline consultation option or in-person consultation option, and the other one is the online consultation option. If you're someone who's staying near the nearest branch of Fidicus, you can come and contact us in person or offline consultation. And if you're someone who's staying far away from us, you can contact us online either through audio call or through the video call. And after the consultation process and taking your case and investigating your reports, especially to online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And if you're staying elsewhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us with any of your problems that you're suffering right now, you can contact us on this number, call us, WhatsApp us, or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's experiencing female reproductive organ diseases like PCOD, PCOS, dysmenorrhea, bulky uterus, it can be hemorrhagic cyst or ovarian cyst, chocolate cyst, endometriosis, adenomyosis, bulky uterus, as well as fibroids, Fidicus Homeopathy is the answer. Why? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. Primarily, the first one being we are already experiencing a lot of patients who are visiting our clinic and are getting good success rate in treating them. We have high success rate in treating them and curing these diseases. Apart from that, there is transparent treatment here at Fidicus Homeopathy. What do you mean by that? There is no gray area between the patient and the doctor. Here the prognosis is very clearly explained to you. The personal care here at Fidicus Homeopathy is top notch. How? We will be answering all of your questions and busting all of your myths. So if you want to treat yourself in a proper manner, if you are seeking for cure, if you are seeking for health, choose Fidicus Homeopathy.